I've heard about shadow boxing. The term shadow pandemic, that's new to me. The number of times people fall sick with a bug that's resistant to the antibiotics designed to wipe it out. A CU Boulder professor tells our Anusha Roy COVID made that worse, and she set out to add some Colorado context with a look at what's happening inside our hospitals.
Dedicating her career to the antibiotic problem, CU Boulder professor Corey Detweiler wants to find a solution.
Superbug is a bacterium that, well, it could be a fungi as well, that is resistant to clinical antibiotics.
The more antibiotics are used, the more a collective resistance is built to the meds that we routinely rely on. In 2019, before the pandemic, the CDC says more than 3 million Americans fell sick with this kind of infection and believes things got worse during the pandemic when antibiotics were given to early COVID patients when it wasn't always necessary. But doctors were scrambling to simultaneously learn about and treat COVID.
Fair amount of chaos.
To be clear, this is not a blame game. In the years leading up to the pandemic, healthcare professionals were doing a better job of being judicious when they used antibiotics. Fewer people died from these kinds of infections, but things fell apart with COVID.
As it kind of had to, given that it was a pandemic and we didn't know what was happening and we didn't know how to treat it.
But now we do, and the CDC says these setbacks can and must be temporary.
I was a little taken aback.
The reality inside Colorado hospitals vary, like at Denver Health, where antibiotic-resistant infections are not surging.
There tends to be much more drug resistance on the coast.
But doctors within the Health One system are seeing an increase matching national trends. The state health department said it's too early to talk statewide trends.
I don't know if it's going to be enough, and I'm hoping not, to make a lasting change.
Part of the solution lies in the way doctors treat patients.
General trend for most all infections is to be shortening our courses of antibiotics. We continue to learn that we overtreat many infections.
Then discovering new antibiotics, which is a slow process for a reason.
For a lot of larger pharmaceutical companies, my understanding is there's not a great deal of financial incentive for them to develop new antibiotics, right? The money is in pharmaceuticals and medications that people need to take for the rest of their lives. Your cholesterol lowering drugs, your antihypertensives.
You add all of that up, we haven't seen a new antibiotic since 1984, according to CU Boulder. CDC and the NIH, they are trying to give incentives and shorter pathways to approval, but Dr. Wiles from Denver Health said they're not really sure exactly how successful it's been yet, Marshall.
I think of the times I go to the doctor or don't go to the doctor and don't want to take medicine. Is this where it's like, should I be asking for the antibiotic, or if I'm someone who isn't, I think my body can handle it myself.
Right.
What are the doctors suggesting?
Right, and so I think they're asking for a little bit of grace and patience from people in the sense that, if you need your antibiotics, 100% you need to take them. But if you have a viral infection, if you've got something that doesn't need to be treated with antibiotics, the doctors are saying, please don't demand it, don't ask for it, don't say I have to have it, because, that means more people are using it, and then you start building that resistance again.
I'm learning a lot of terms
right?
in the last couple of years. Thanks, Anusha.